All right. And let me see if I can figure this out again. All right, there we go. So you should all be able to see this now. So I'm going to start out just sort of talking about the basics of everything, and then from the naturopathic side of stuff, which tends to be kind of the quote unquote sciencey part of things, I guess, a little bit more on the conventional side of the world. And then Alexis is going to follow up with talking about homeopathy and some specific cases, I think, right? So this is me.
Yes, sorry, I was muted. Yes,
oh,
I'm
no
presenting
problem.
some cases.
So this is me. I also trained as a homeopath for a long time, so I love homeopathy, and it's one of the reasons I love partnering with Alexis, because it's just such a great crossover. So that's me, and that's my email address where you can find me. So we're going to start by just going back to basics, talking a little bit about the female menstrual cycle. We're talking about dysfunctions of all kinds in the female hormonal cycle. So I'm going to start by just giving us all a little refresher. This was a refresher for me too, just going over all the basics. So we'll start with the big picture, and what I really want everyone to kind of take home from this is how complicated it is and how everything is interconnected. It's really easy to kind of get into the microscopic minutia of hormones, and I think for simplicity's sake and for kind of a broader understanding, it's really good to keep in mind how everything is connected and how all hormones affect each other. So this is the basics. A standard quote unquote normal cycle is 28 days. The moon cycle is 29.5 days. So there's always been that association between phases of the moon and phases of the menstrual cycle. This starts with the follicular cycle and then goes around. So the follicular cycle is when the follicles or eggs are developing. And then when they're developed to a certain point, they're released in the ovulation phase. So that's somewhere mid-cycle, like day 12 to 16-ish. If the egg is fertilized, then of course you have a pregnancy. And if not, then the lining of the uterus that was getting all prepared to have an egg implanted, a fertilized egg implanted and to grow a baby, if that lining is not necessary, that sheds, and that's what we call having a period. The bleeding happens because all of the vessels that were created to feed that uterine lining have to break in order for the skin cells to slough off. So the hormones involved in this, there's way more than this, but this is the simple version. So in the follicular phase, day 1 to 14, you have kind of flatline LH and FSH, and I'm going to talk about in a minute what these actually are. We're going to go into a little more detail about what each hormone does and its importance in the whole system. But you can see the first half is a little bit more estrogen, flatline progesterone, and the second or luteal phase, day 14 to 28, get a big spike in progesterone, a little rise in estrogen, and then they both fall really dramatically. And it's that drop in both hormones that actually triggers the uterine lining to start to release and for bleeding to start. FSH and LH in the center have more to do with fertility and ovulation. So this is an important piece that I wanted to bring in, a little something from Ayurveda. I am not an Ayurveda, I just want to put that out there, but the little bit I know about Ayurveda, I love it. So hormones are an aspect of ojas, or our kind of innate vitality, our immune system, all of our hormones. And because of that, we have to be well nourished and we have to have a little extra. We can't be just scraping the bone and depleted. Otherwise, we can't make adequate hormones of any kind, female, adrenal, thyroid, none of them. So we want to be juicy. If you think of what babies look like, squishy, big cheeks, their skin is so soft, that really juicy, dewy, soft kind of quality, that is kapha in Ayurveda, or that juiciness, the essence of ojas or vitality. And that's what we want our insides to be like, really, to be really thoroughly nourished and juicy, to be able to make hormones. And a big part of that is cholesterol. Cholesterol gets a seriously bad rap, but it is incredibly important in hormone production and fertility, particularly. We often talk about high cholesterol, but you can also have too little. And I've seen quite a few women with infertility who come in with cholesterol levels under 150, which is just way, way, way too low. I think for healthy fertility and for healthy hormone production, provided everything else is in normal range, cholesterol should be somewhere between 175 and 200. And this is just a simple graph to show you how cholesterol feeds all the different hormones, how you have pregnenolone, which is the big precursor to a lot of the other types of hormones. And without getting into too much detail, you can just see how they're all connected. So our 40s are kind of the prep decade for menopause. And the reason I'm bringing this up now is we're going to talk a little bit more about cholesterol and adrenal and thyroid hormones. But how we take care of ourselves from 40 to 50 will really impact how we experience menopause. And particularly talking about that juiciness, that ojas, and our levels of cholesterol, and also our stress levels and adrenal hormones and thyroid hormones. All of those are very interconnected. And the better we care for ourselves, we're just going to have that extra. We're going to have a little extra to give so that when hormones naturally start to decline, we're going to have much less likely to have symptoms. And I attached a handout to the email I sent with the second Zoom link that I'm not going to go over in detail, but in the vein of adrenal health and stress and how it all impacts our female hormone production. It's a little discussion of dinacharya, which is another Ayurvedic technique of making your daily routines into ritual. And it's just one simple thing that is a stress reduction technique. And it's also really beautiful. It comes from some ancient teachings in Ayurveda. So you can read through that at your leisure. And you can always ask questions about it if you want to later. But adrenal health is really important to hormonal health in general. So you can see from this little chart again how cholesterol is really important. It can go in a few different directions, but in this case, we're talking about pregnenolone and then what it becomes after that. So if at the top of this chart, your adrenal glands are depleted or overactive, so if you're under chronic stress or you've been under chronic stress for so long that they've become under functioning, a lot of those hormones downstream are going to be depleted or they're going to be completely out of balance. Like you might have very little progesterone and cortisol, and you'll have way too much DHEA, testosterone, and estrogen. So there can just be, the scales can tip in one direction or another, and that can lead to a lot of the symptoms of PMS, heavy bleeding, cramping, anxiety, feeling extra fatigued. So we talk a lot about thyroid health, and we tend to talk a lot about female hormones, but adrenals get missed a lot of the time. And I think they're really kind of the crux. So what happens is this progesterone steal. When there's a lot of stress and there's a hormone imbalance, the body will steal from the progesterone, the base level of progesterone in the body in order to make other stress hormones to try and counteract the stress or inflammation in the body. And so we want to try and counteract that, of course, with our diet and our lifestyle. And so I hope that that little handout I gave you is helpful. And when we talk about stress, so there's no simple recipe for stress management, but the one thing you can do is schedule and regularity of daily routines. I know it sounds super boring and nobody wants to do it, but is the thing that our body loves the most. Our body loves to be in a 24-hour circadian rhythm where you go to bed at the same time, you get up at the same time, you eat meals at the same time each day. And that really simple regularity helps regulate our hormones. It helps use our base nutrients and pull them into the areas where they need to go. It also keeps our stress level and inflammation in our gut low so that things are absorbed well and we have enough nutrients to make all of the hormones that we need to make. So this is a big part of why I included that handout for you. And then no talk would be complete by me if I didn't include some gut health, because this is kind of my area of specialty. And gut and hormone health are intimately connected. I mean, the digestive system is the foundation of good health. hormones included, but everything else. If you're not absorbing or detoxing well through your digestive system, you're not going to have the raw materials to make hormones, and things are going to be depleted or just radically out of balance. So I found this great little depiction on the internet that just shows you a really simple image of some things that can happen. So constipation, or you could say just slow motility in the gut. If things aren't moving well, you're not going to get excess hormones or anything else, any other toxins out of the body. They're going to get recirculated and eventually stored in fat tissue. Leaky gut and other infections or imbalances in flora can increase the stress hormone cortisol, which is from the adrenal glands. It can also become depleted over time, but that's basically when inflammation is high, your body tries to combat it by making excess cortisol. And then all the sex hormones, so female hormones, testosterone, can influence how fast our gut moves or how slow it moves. So too much or too little can be a bad thing. And then any inflammation in the gut or in your entire body can impact how well your hormones are made and how well they're broken down and discarded from the body. And low stomach acid, another one of my favorite things to discuss, can really radically deplete your nutrient absorption. So if you're not breaking things down in the very first stage of digestion in the stomach, you're not going to get those things absorbed well in the small intestine, and that's going to impact how well your body makes hormones. And really, all of the different symptoms, complaints that we could think of in the menstrual system come from some sort of imbalance in the hormonal system. That's part of the picture, but not just progesterone and estrogen, the other hormones as well, thyroid and adrenal, testosterone, DHEA. And then, of course, I can't not say something about thyroid, because this is the thing that we talk a lot about and it gets tested a lot. And thyroid does a whole lot of things in the body. I mean, that would be its own 3-hour talk. But I just wanted to show this simple depiction because I think we all know how common thyroid dysfunction can be. It's talked about a lot. But the really important part here is that adequate thyroid hormone makes the receptors in the body, all over the body, in various different organs and tissues, more sensitive to other hormones. So estrogen and progesterone, for example, float around and they bind to receptors in various parts of the body, not just the ovaries and uterus, but the brain and the nervous system. And those receptors have to be sensitized or receptive to the hormone that they bind to. And thyroid hormone helps do that, among other things that it does in the body. So that's the kind of basic overview, and I know that was super fast, but the idea that all of these hormonal systems are super interconnected. And then we're gonna look at the details of each one of those hormones and some things that can go wrong when things are out of balance. Typically what goes out of balance is estrogen becomes too high. That's the most common. So this is a little bit confusing to look at, but it's a really great depiction. Try not to look at the pluses and minuses and get too embedded in it. But it's great because it shows the HPA axis, which is the adrenal axis. It includes the hypothalamus and the pituitary. It shows you where the adrenal glands sit on top of the kidneys. And then it also shows the female hormones, the LH and FSH, estrogen and progesterone, and all the red lines that someone actually drew in and then uploaded it to the internet, show you that certain things, like look at how many things excess cortisol inhibits. It inhibits that entire side, everything, pretty much every function on the female hormone side is inhibited when there's too much cortisol. So too much cortisol is too much stress, too much over functioning of the adrenal system, and or too much inflammation in the body somewhere or anywhere. And then all the things that progesterone does, you can see that it goes back and it increases some things. It's used to make cortisol. It's also used to make estrogen. So progesterone gets used up quite quickly, and estrogen tends to be recycled and recirculated so that an excess of estrogen is very easy. It's very easy to create excess estrogen in the body and progesterone to become depleted. Again, creating that imbalance that's going to lead to symptoms. So estrogens, there's three main ones, but there are many, many, many metabolites or other variations of these in the body. Estradiol is the one that's most common during reproductive years. Estrone is more common and weaker. It's less active, so it's more common in peri and postmenopause. And then estriol is really specific to pregnancy. It's around, but it's in pretty small amounts. It's higher during pregnancy and right after birth. So some of estrogen, again, just like any hormone, does a lot of things in the body. This is not an exhaustive list. I just pulled some things that lead to symptoms that we might experience or know people who do. So estrogens stimulate the growth of the follicle. So they start the ovulation process. Decreased estrogen, which is less common in reproductive years, more common in menopause, and along with lower serotonin levels, it leads to increased appetite and weight gain. So this is one of the reasons why weight gain can happen in menopause, but this can also happen at other times in life, not necessarily just menopausally. Elevated melatonin, so if your melatonin levels are too high or you're taking a lot of exogenous melatonin, that can actually decrease your estrogen levels. For better or worse, like you might actually want to decrease your estrogen levels, and so that could be a therapeutic thing, or it could be decreasing them too much. But there's a big connection between melatonin and female hormones. And then I think the biggest piece for most of us, and especially for younger women and people in reproductive age, is the connection between the gut and proper estrogen balance. The gut has a lot to do with getting rid of used estrogen. So after estrogen floats through the body, attaches to receptors, and does its business, it is bound to bile and it goes all the way through the intestines and should go out in the stool. It should be pulled out through the large intestine. But sometimes if our microbiome is out of balance, we don't have the right bugs in there called the estrobolome, that won't happen, and instead the estrogen gets reactivated in the gut and recirculated back through the liver, and suddenly you have all this extra estrogen which wasn't supposed to be in play. And this, in my experience, has a lot to do with, especially when you see young women with endometriosis, painful heavy periods, lots of PMS, lots of excess, lots of pain and bleeding, that it often has something to do with high estrogen or just higher estrogen in comparison to progesterone. And the gut is often a big culprit. So keep that in mind. Progesterone, as we saw before, is connected to pathways in the adrenal glands. It shares common pathway with cortisol, as well as it can be turned into estrogen and other things. So progesterone to me is kind of the juicy, healthy, happy hormone. It's the hormone that's really high during pregnancy. It's what maintains a healthy pregnancy. And it's what makes pregnant women's skin look really soft and supple. It's what helps ligaments and tendons to stretch. It makes everything juicier, basically. And so when you think of conditions where estrogen's too high and progesterone is too low or being stolen and turned into stress hormones, you lose that quality of having a little extra. You start to feel a little bit drier, you start to feel a little bit maybe overheated, having pain syndromes. Those things are more associated with when progesterone is low. And this is also a big issue in younger women who have taken hormonal birth control for a long time. The progestins that are in birth control are not progesterone. They're not molecularly similar at all. So they don't stimulate any of the receptors that natural progesterone does. But they tend to block receptors, so they can block them from progesterone doing what it should be doing. And they suppress ovulation. And a large portion of our progesterone, when we are still ovulating, comes from the production of eggs and the release of those eggs. The adrenal glands make progesterone as well, but in small amounts until we hit menopause. The majority of our natural progesterone comes from our ovaries. So if you are suppressing your ovarian production of eggs every month with hormonal birth control, you're also suppressing your body's natural progesterone production. And that can put a little strain on the adrenal system, because then suddenly the adrenals try to help out and take over earlier than they should have to. The other really cool thing about progesterone is it is a neurosteroid. It actually has a lot of receptors in the brain and the nervous system, and it helps protect the integrity of the coating that lines the nerves and the brain. So it's really important in kids for developing brains, and just in general as we age. It's an age protective hormone. Oh, this says estrogen levels. That's a typo. Melatonin also decreases progesterone levels. So it decreases both hormones. And in some studies I read, they actually showed that for women who wanted to shorten their cycles, like if they had really long 38, 45-day cycles, that sleeping with a 200-watt light on, not that you would want to do that, because it also causes a lot of other issues, but it shortened their cycles by like 10 days. And I think it's mainly because it decreases your melatonin levels when you have a light on. So it's not necessarily something you want to do, but it shows the interaction between melatonin and estrogen and progesterone. And having adequate progesterone balances some of the effects of estrogen. One of the things that estrogen does is it tends to increase tissue production. And we're going to talk a little bit about that in a moment when I talk about some of the things, some of the symptoms and syndromes that people can get. But it causes increase of uterine tissue, endometrial tissue. It plays a role in fibroids, and adequate progesterone tends to balance that so that tissue doesn't grow too much. It's being stimulated properly and not excessively. So FSH and LH, not nearly as important in the overall scheme of things. They really are much more just about eggs being matured and eggs being released. And FSH will start to get really, really high as we get older and our ovaries are no longer producing eggs. So FSH means follicle stimulating hormone. It encourages the egg inside the follicle to start to mature. And then LH comes in and sort of knocks on the door and says, all right, now it's time to be released. And it stimulates the actual release or ovulation of the egg. They both go up, but FSH goes up more initially and as we approach menopause. These two are markers for reproduction and fertility. And they really help with regular menstrual cycles, because if you're ovulating regularly between day 12 and 16, you're much more likely to have a 28-day cycle, unless there's something off with the hormones in the second half of the cycle. But that proper ovulation is really a big trigger for having regular, healthy, less symptom menstrual cycles. So these are some common things that I think probably everyone has heard of. They're way more than this, but these are the big ones. Endometriosis, which in my little research, depending which country you look at and age range, it's anywhere from 6.6 to 16.2% of the population. And those are only people who actually go in and get diagnosed. A lot of times women just suffer with heavy, painful periods and they don't ever get the diagnostic parameters checked. So this is a high estrogen problem. Why it happens in certain people, no one really knows, but there's always elevated estrogen and typically low progesterone. So that, like what I mentioned, the lining of the uterus, that endometrial tissue of the uterus is being constantly triggered to produce more and more and more. And then it gets outside of the uterus. And endometrial tissue can really be anywhere. In really severe cases, it can grow on the ovaries. It can grow anywhere in the abdominal cavity and even more distant areas in the body. But the biggest problem with it is because it's endometrial, it's uterine tissue. When you're having a period and the lining starts to slough and you bleed, all the endometrial tissue in your body is triggered to do the same thing. So you get bleeding in areas where it shouldn't be, and of course it's painful. Heavy painful periods are typically the big symptom that people have. And sometimes infertility, although sometimes getting pregnant will heal endometriosis. And the belief, I think, is that high prolonged levels of progesterone counteract the elevated estrogen. And after birth of the child, those the levels of both tend to even out. But a lot of women can have a very hard time getting pregnant with endometriosis.
Sangeeta,
Yeah.
I just want to let you know we have a comment that some of this is very granular medical stuff that's a little hard to understand, and I want to make sure that you also include practical, down-to-earth stuff that people can really get if they don't have a total grasp on medical concepts.
Yep, and I'm going to get to that. We're going to talk about some of I have a case study coming up that we're going to talk about, a real life case example that is typical of some of the patients that I see, and that will have a little bit more information. But at the end, if there are specific questions that people want, because I think, Alexis, you might end up covering some of this too. But yeah, I will try to cover that. So fibroids are more common in younger women. And again, a lot of women don't even know they have them. It's just growths of extra tissue in the uterus. They're not cancerous, but they can be painful. They can cause a lot of painful periods. And again, no one really knows why they happen or why certain people get them. And this to me is a great, these things are often really well treated with homeopathy. I'll just say that I am a big proponent of a lot of menstrual dysfunction and irregularities being treated with homeopathy. It works really well. My part in this is often trying to discover if there might be some underlying cause that's creating these things to happen, that's adding to the risk of these things happening. So, and then ovarian cysts are another one that a lot of young women get because they happen because of ovulation. And hormonal birth control can increase the risk of cysts because it's suppressing those eggs from being released. And so they're not allowed to eject out of the ovary every month. And so that can build up a little fluid-filled pocket. And then every so often, the eggs that are inside that fluid-filled sac will be released, but it can be really painful. And these are often diagnosed just on accident because someone has a painful ovulation or a painful period and they happen to find it. But a lot of women don't even know that they have them. Okay, so we're going to talk about a case example. So if you have these symptoms, and you might not know that you have any of those big word things, endometriosis or fibroids or whatever, but you might struggle with just heavy periods or a lot of PMS or feeling anxious around your menstrual cycle or having insomnia. And that's often what I see. I don't see people necessarily coming in and telling me that they have one of these conditions sometimes, but they often just come in with a series of symptoms. And so I pulled this patient because it's a complicated case in that she had a lot of things going on. But I wanted to give you an example of some of the testing that we do. And so if you just look, she was 41, and some of her complaints were severe PMS with mood changes, lots of fatigue. Fatigue was one of her biggest complaints. She had pretty short cycles, so they were less than 28 days. Pretty light bleeding, not a lot of pain. That was was typical for her. Tons of fatigue. She was sleeping a ton. She'd started to gain weight. She had decreased exercise stamina. She's an athlete, so she was no longer able to run or do a lot of the vigorous activity that she was used to. And she thought that might have to do with the weight gain, but she just didn't have energy. She was very easily overwhelmed and anxious, which was also something that was somewhat new to her. She had always felt like she had a pretty high threshold for overwhelm and for chaos. She's got 2 or 3 kids. I think 2 kids who are older now, but she always felt pretty resilient until recently. She had heartburn, which was off and on lifelong, but had gotten worse, and lots of abdominal bloating. She had diagnosed hypothyroidism, so she had low thyroid numbers, and she was taking thyroid medication. And she also had lifelong asthma that was currently being controlled with either oral or inhaled steroids, depending how bad it was. And so some of the hormones that I mentioned earlier, are all on this graph. You can see her progesterone levels, her estradiol. She's still in reproductive age and still having cycles. Testosterone, DHEA, which is a precursor to cortisol and testosterone. And then the cortisol graph there at the bottom. And so the reason I chose this particular case is it shows how her hormones were connected to a lot of these, I think, fairly common symptoms of, severe mood changes and PMS. And you can see that her estrogen levels are really high and her progesterone levels are really low. So that big expanse between high and low. This shows
Can I ask you a question about that?
Yeah.
When we're looking at this graph, just in case the participants don't know, the green area is like the range of normal, and then that black triangle and the black dot are the test result where it actually fell, right?
Yes, exactly. Thank you for that. I forget, I'm so used to looking at these that you may not know that. So thank you for reminding me. Yeah, the arrow, like where it says saliva estradiol, it just means that it was so high it's above the graph. It doesn't even tell you. There was another page that gives the number, but the graph is easier to read. And same with DHEA. It was so high it was off the chart. And then each of these green areas, there's a green line in the middle, and that's kind of the median. That's the line that you kind of want to shoot for, is right in the center of the green area. And you can see that her cortisol graph, the morning number, that triangle, is off the charts, but everything else is really low. So she has really imbalanced adrenal system. She's got imbalanced female hormones, and her symptoms show a lot of that. She's very, very tired. And this is why, because her cortisol, her adrenal system is very depleted, and her female hormones are also very out of balance. So, and then the interesting part, so these are the medications she was taking when I met her. Levothyroxine, which is Synthroid, it's a thyroid medication, 50 micrograms, which is a fairly low dose. Qvar, which some of you may have heard of, is an inhaled steroid for asthma, and then a albuterol or rescue inhaler as needed. And she had started taking progesterone, bioidentical progesterone cream or tablets, and it actually made her worse. She developed really horrible cramps and heavy bleeding, and her cycle got shorter, so she stopped taking it. And this was before I met her. She was having some trouble sleeping, I think, and that was part of the reason she was taking progesterone, because it can help with insomnia. So what did we do? We ran some other tests just to see what she might have, and she had a lot of stuff going on. So what originally seemed like a hormonal issue turned out to be hormonal with a lot of other stuff. She had a positive Lyme test with a couple of different organisms. She had positive yeast overgrowth and parasites on a stool test. She had a bunch of increased gut inflammatory markers, so her entire digestive system was inflamed. She had low white blood cell count, which means her immune system was depleted and not functioning very well. And she had elevated EBV, or Epstein-Barr, or mono is what it's often called when people have mono. She had elevated EBV antibodies, so her immune, again, showing that her immune system was struggling. And she had not only low thyroid numbers, but she had positive thyroid antibodies, thyroid peroxidase antibodies, a little bit, 98, which isn't super high, but that's common in people with thyroid dysfunction. But it just showed that her system was really out of balance with some autoimmune tendencies in her thyroid gland, all of the hormonal things we just saw, plus all of these other things going on. So then for treatment, we supported her adrenals, because on the cortisol graph we saw they were very depleted and too high at night. So we wanted to balance her nighttime high levels with her daytime low levels. So we did a little bit of that. We supported her immune system with some herbal formulas, some nutrient supplements, and IV ozone, which is a special thing we do here in our office for chronic infections and immune support. We cleaned up her gut a lot. So we basically killed off a lot of the stuff that was in there that shouldn't have been there. And then we replaced it with good things like probiotics and anti-inflammatory things. And we used some herbs and some pharmaceuticals for that. We supported her mitochondria, which is her cellular energy, to get her up and being able to exercise again. And then we also did some nasal sprays and allergy support to help with the lungs. And we changed her from a vegan diet to more of a paleo diet. She wasn't eating any meat initially. She was eating just plant-based diet. And that was part of what that, along with her gut stuff, was leading to a lot of depletion, and she wasn't able to make hormones. So what happened? She's still a patient of mine, by the way, and this isn't over, but she lost the weight around her midsection that she was really worried about. She felt like her belly was finally back to flat, like it had always been. The abdominal bloating resolved, her digestion improved, her energy and exercise stamina improved, although not back to 100%. She was able to do more activity than before. She was still sleeping a lot and fatigued, but she was no longer napping, so her energy was much improved overall. The anxiety and overwhelm were greatly improved. She was no longer feeling super anxious, especially around her periods. She was able to go through each menstrual cycle without that intense anxiety and feeling overwhelmed by every little thing. And then her asthma currently has gotten worse from the fires, so we've started dealing more with that. But that was sort of an aside. All of the hormonal things were much improved. So what have we learned? I hope that hormones are complex and complicated. They interact with each other a lot. They are an indicator of our overall vitality, which I think is a really important point, that how well balanced our hormones are, how well they're balanced, what our thyroid and adrenal and female hormones are like in our body is an indicator of how healthy our system is overall, not just in one area, but in our whole system. Every hormone affects every other hormone, and you ultimately have to treat the whole person. So even if someone comes in with just what they think is a single complaint, it's always good to do some, for me as the doctor, to ask a lot of questions, get all the details of every symptom, and make sure we're looking to see if there's anything else that might be affecting the menstrual cycle, that might be affecting the hormone levels, so that we can really get at the root cause if possible. And sometimes we can't do that, but we try to do our best to look at the whole person and every possible symptom and how they're all interconnected. So, and we can talk about more specific, if you have specific questions afterward, please let me know. These I just included for you for later, just some fun facts about hormonal changes, and this really great video from 1946 about menstruation that I watched. It's a 10-minute video, and it's reportedly the first time that the word vagina was ever used in a film made by Disney. So you should really watch it if you have a chance. And that, I'll let you read over those. They're kind of fun. And if you have questions about any of them, we can talk about that. But that is it from me. So I will turn it over to Alexis.
Thank you so much. That was so wonderful. And I just love what you do. It meshes so well with what I do. So let me share my screen. So let's see. All right. Hoping you guys can all see that. Okay, so we're going to talk tonight, as I think we've gathered, about menstrual dysfunction. And I'm a homeopath with a family practice focusing on women's health in San Anselmo. So my focus is on treating women homeopathically. And I love, my favorite thing is partnering with a naturopathic and functional medicine doctor like Dr. Pedro, because then we can work at the problems and issues from both sides. But just for a brief overview for people now and people later watching the recording, we'll just have a brief couple-minute overview of what homeopathy is. Homeopathy is a specific modality of alternative medicine, not to be confused or lumped in with naturopathic medicine, Chinese medicine, herbal medicine. Those are all unique and discrete entities. Homeopaths work with remedies that are formulated homeopathically. That's a very specific way of creating homeopathic medicines that is unique in the alternative medicine world. There are over 3,000 homeopathic remedies, and perhaps you know arnica. It's the most widely known remedy. Another very popular remedy, particularly during flu season, that you see on the shelf at the Whole Foods checkout stand is acetylcoccinum. That's another homeopathic remedy that no one knows how to pronounce. So now you know, acetylcoccinum. It's a remedy for the flu. So in homeopathy, a remedy is chosen for you based on your unique symptoms. Unlike in allopathic medicine, where 20 people with strep throat might all get the same antibiotic, a homeopath is going to be looking for your unique expression of your symptoms and giving you a remedy that's chosen just for you. It's energetic medicine made, it's minute diluted doses of varying substances, 3,000 plus substances. And so the way that it works is that it stimulates your vitality and body systems to return your body to health. Unlike an antibiotic that goes into your body and actually kills living things like bacteria in your body, this stimulates your immune system to right itself, to get rid of the bacteria, to get rid of the virus, and return your body to health. So as such, it's very gentle. It has no side effects. It's safe for all ages and conditions. It's effective, inexpensive, non-toxic, and green medicine. It's widely available at health food stores and online. You can get it at Whole Foods, Sprouts, Pharmaca, Nugget, tons of places. Even CVS Pharmacy has homeopathic remedies. And so it's very widely available and inexpensive. Also, you can buy a tube of homeopathic remedies and it can last you 20 years. So it's extremely efficient. It's based on simple principles. How we use homeopathy is based on a principle first observed and documented in 400 BC by Paracelsus, which is the law of similars, which states like cures like. And this, very simply, is how homeopathy works. We match a patient's symptoms to the known symptoms of a remedy. So we are looking for the patient's symptoms to be just like the symptoms of a remedy. And how do we know that? We look up remedies in our encyclopedia of remedies. We call it a materia medica, and we match the two. So for example, we all know what a bee sting feels like because I think probably everyone in the world has been stung by a bee or a wasp. We know that the skin gets red, just like in our picture here. It's hot, it gets swollen. We see the red, the white circular swelling right around the actual puncture wound there. And there's pain. It's stinging, burning pain. So the idea in homeopathy is that we're going to find a remedy with those symptoms, and the symptoms of the bee sting will be neutralized. So for example, this remedy called Apis mellifica, which ironically or not is made from a bee, has these symptoms, which I pulled right out of our encyclopedia called the Materia Medica: swellings after bites or stings, stinging pain, hives, burning, stinging, and itching, redness of skin with sensitivity, edematous swellings, that means with fluid in them, and it's a specific for insect stings or bites. So when we give the remedy Apis to a person with a bee sting, because those symptoms are alike, it relieves the pain, swelling, and redness in just a few minutes. So this is an acute situation, of course. Having a bee sting is not a chronic problem, it's an acute problem. And acute problems arise and resolve in a short time. And homeopathy can be used very effectively and easily by anyone in acute situations with some training and the tools that you need to do it, which is essentially books that you look the remedies up in and then the remedies themselves. But what about the conditions that arise and don't resolve, or conditions that stay for months or years, or conditions that we're born with? These, of course, are chronic problems, unlike a bee sting. And homeopathy's role in the resolution of these chronic situations is to restore harmony and balance to the whole person, mind, body, and spirit, all the symptoms that are causing problems. So chronic cases are treated using the same principle of like cures like, just like the bee sting. And when treating chronic disease, it's best to work with a professional homeopath rather than treating yourself. And this includes many, many conditions, some of which are listed down here at the bottom. Menstrual pain is one of them, menopause symptoms, sleep disorders, mood swings, asthma, eczema, and so forth. There are many things you can treat yourself at home, any acute illness, injuries, stuff like that. It's wonderful to have as a tool to treat your family. But when you're dealing with chronic things, you want to come to a homeopath, which brings us to how chronic homeopathic treatment supports women's health and specifically menstrual dysfunction, which is what we're talking about tonight. So, of course, the number one thing that we are doing is eliminating or improving the symptoms of the chief complaint, which may be pain, it might be bleeding, might be endometriosis. But in addition to that, we're also improving and supporting mental emotional health. Just like in Sangeeta's case study, she saw an improvement in her mental emotional health, less anxiety. We are looking for the same thing because we're treating the whole person. We're not just treating one little portion of a person, it's the whole person. And we're improving and supporting whole body health beyond the chief complaint. So maybe in addition to your cramping, you've also got a skin rash or some anxiety. We're improving everything globally. And of course, it supports healing in the glands directly. So tonight we're talking about menstrual dysfunction. So there are many, many symptoms of possible menstrual dysfunction. And so I've listed just a few, but there could be more. This is just a list that doesn't include everything. You can have painful cramping. It's very common. An estimated 50 to 90% of young women experience pain with their periods. You can have concomitant symptoms. The word concomitant sounds fancy, but all it means is things that are going along side by side with the main complaint. You can have nausea, vomiting, diarrhea, headache, or lightheadedness with your period. Heavy or excessive bleeding, which we define as soaking a tampon or a pad every hour for 6 or more hours. That's heavy and excessive bleeding. Could also be bleeding that goes on for more than 7 days. Periods can be too long or too short. As we just learned, a typical cycle is 28 days with 3 to 5 days of flow. Your periods can be irregular. Maybe sometimes they're 40 days, sometimes they're 18 days. Maybe you skip one now and then. This can be normal when you're a teenager, as your hormones are still trying to reach their level of regularity, but after that, they should have more regularity. It can be pain with ovulation. What's normal is to have no awareness of ovulation at all. So you shouldn't feel anything. So if you are feeling pain when you ovulate, that's something that we can treat. Endometriosis, as we just talked about with Sangeeta, it's estimated that 10 to 15% of women have it, and you're more likely to have it if your mom had it because it runs in your family. Fibroids, the NIH says that 80% of women will develop fibroids, but often with no symptoms. Sometimes symptoms of fibroids are heavy bleeding and pain, cramping, but sometimes none, so people don't even know. Many people have PMS. The Mayo Clinic says 75%, 3 out of 4 women have experienced PMS at some point. I think if we interviewed the men of the world, they might say it was more. Amenorrhea, that means there's no period at all. And this can be for a variety of reasons. And this is just one aspect of menstrual dysfunction, is the lack of a menstrual period. And of course, there's more. And just a note to you all, we will be talking about perimenopause and menopause symptoms in our next or a future women's health seminar, because that's a whole topic unto itself. So with homeopathy, though, it's all about finding the right homeopathic remedy for you and your symptoms. So here's our little graphic, but you might have migraines, sweating, and a backache, and someone else might have a stomach upset and fatigue and vomiting. So we have to find the right remedy for you. So we're going to talk a little bit about the symptoms I've picked out 4 symptoms, and we're going to talk about the remedies that treat these symptoms. So number 1 is heavy bleeding. This is something that a lot of women complain about. We just talked about 50 to 90% of women have heavy bleeding. This can be prolonged bleeding, like it goes on too long. Maybe it happens chronically every period. It's profuse, like there's just so much. It can be gushing, bright red. It can be dark or black, clotting or stringy. And bleeding, excessive bleeding like this can cause anemia. So what I've done here is, this is not going to look familiar to you, but this is my handy dandy program that I have where I put symptoms in, and I'm going to call it my handy dandy remedy finder. So down the left side are the symptoms that I've just described up at the top. Metrorrhagia is bleeding in between periods. Menorrhagia is bleeding, prolonged heavy bleeding, and we have all these symptoms here. And then across the top are the remedies that are indicated for each of those symptoms. So what we're going to look at is that we see a bunch of remedies come up that treat these kinds of heavy bleeding issues. Sabina, Eustilago, Belladonna, Ferrum. You may know ferrum is the word for iron. This is a remedy made from iron, and you can understand that that would be related to bleeding because ferrum can treat anemia. And so it's a really important remedy for excessive bleeding. Pulsatilla, sepia, platina, ignatia, natrum muriaticum, and lachesis. It's not important that you remember all these names. There will be no quiz at the end, but I am going to talk about, we're going to see these names over and over again, and you're going to start to see that we have remedies that really treat women's health. Sabina, pulsatilla, sepia, ignatia, natrum muriaticum, and lachesis. We talked about a few of these in our last webinar. I went into some detail about sepia and natrum muriaticum, and the mental, emotional, and physical picture of those remedies so you could understand more. So now we have pain. Pain can come in all different forms. Of course, it can be mild pain, and then most people with mild pain don't even think about it. They just think, oh, I've got mild pain. They don't even mention it to their doctor. But sometimes people have really extreme pain that's debilitating and actually causes people to miss school, miss work. It really messes up their lives and messes with their quality of life. So the pain can have many kinds of qualities. And these are the kinds of things that I would ask you if you came to see me. I would say, what is the quality of your pain? Is it cramping, gripping, stabbing, twisting? Is it neuralgic? Neuralgic means nerve pain. Is it labor-like? Do you feel like you're having another baby? Do you have a feeling of bearing down, like your uterus is going to fall out and you have to cross your legs to hold it inside? Believe it or not, that's a very common symptom of sepia. It can be very sudden pain. It can be violent pain. The pain can extend down the legs. It can extend to the lower back. It can be accompanied by nausea and vomiting. And so here we see with my handy dandy remedy finder that we see I put in all these symptoms on the left, and then I see the remedies across the top, and it's a lot of the same ones that we've seen before. We see sepia, pulsatilla, belladonna, simicifuga. That's called black cohosh, which is actually an herb that they use in pregnancy to stimulate labor. Calicarbonicum, lachesis, sabina, we saw that before, natrum muriaticum, lilium tigrinum, and eustilago. So these, again, are the heavy hitters that we've seen before: sepia, pulsatilla, cimicifuga, and so forth. So we move on to endometriosis. Now, endometriosis is a very specific condition. Not everybody has it, only 10% of women, as we talked about. But people who do have it, their lives are altered by having endometriosis. There is so much pain. And they have extreme pain with ovulation and with their period, severe cramping, sensations of pulling, tightness, painful sex, and the quality of the pain is neurological due to the nerve fibers that are embedded in the endometrial tissues. There's a very high quantity of nerve fibers in those endometrial tissues. This is when the tissue that's inside the lining of the uterus is actually outside the uterus in other areas of the abdominal cavity. So during those hormonal fluctuations, those tissues start to swell and have blood, and then they shed, and there's nowhere for it to go because it's inside the abdominal cavity, and it causes really extreme pain. So here is my handy dandy remedy finder, and we see when I put in these symptoms that we have some very familiar faces coming up. We see pulsatilla, sepia, spigelia. It's a very neuralgic remedy, also for migraines with a neuralgic pain. Sabina, Lilium tigrinum, and viburnum. You see a lot of plants here. These are some remedies we've talked about before. Sepia is something we've talked about last time, and Sabina and pulsatilla we saw in the other two. Now, PMS, of course, is a terrible thing that affects not only women, but all their families as well. And if we could eradicate it, the world would be a better place. This is where, of course, people feel irritable. They have sudden mood changes, sadness and weeping. They feel angry. They have cravings for chocolate, ice cream, and salty food, and sometimes all three of those together, and often painful swollen breasts before the period. So here's our handy dandy remedy finder, and we see, wow, sepia is coming up right there at the top again. We have phosphorus, natmur, pulsatilla, carcinosin, lachesis, nux vomica, and cyclamen. That's another plant remedy. So these are some big heavy hitters that you can see. All these remedies have shown up in our previous lists. So these are some very common women's health remedies. We've got sepia, pulsatilla, sabina, belladonna, carbonicum, natrum muriaticum, and so forth. You can read the list. Each one of these remedies has a full-fledged picture of all of its mental, emotional symptoms and all of its physical symptoms, including the menstrual symptoms. So we're talking about that tonight, but each one of these is a fully fleshed out remedy that I can look at and say, is this remedy like this patient of mine that I've just seen? And that's where I'm looking for that like cures like. So last time I talked about sepia, natmur, and calc carb. And if you want to hear those descriptions of those remedies, you can look for our video on our thyroid webinar that we did. It's on my YouTube page, and I think probably on Sangeeta's YouTube page as well. Tonight, I'm going to talk about pulsatilla because it's a wonderful remedy for menstrual problems. And then I'm going to talk about two cases for you. So the mental state of pulsatilla, this is the little flower at the bottom that you can see. It's called a wind flower. It's a soft, timid, easily influenced person who is open and malleable. This is a person who wants and is better from consolation. They're looking for support from their friends, from their family. This is going to be a child who's in a pulsatilla state is like a very affectionate child who is a little bit clingy and is maybe a little bit weepy and says things like, "Do you love me, mommy?" This is a very sweet and open person. They can be sad, especially before the period. There can be changeable moods. In fact, changeability is one of the hallmarks of this remedy. If we see a case where we can't find a pattern with the migraines, with the period, with anything. Things change all the time with the mood. First I'm irritable, then I'm jealous, then I'm happy, then I'm sad, then I'm weepy. This is the hallmark of the remedy, is changeability. We see a lot of irritability worse before the period. There is a feeling of forsakenness. Now, what does forsaken mean? That means, like, do people really love me? I feel alone and lonely, and I feel insecure about my lovability. And so there is this question, do you love me? And maybe you don't say it out loud. Maybe it's just internal. Do I feel loved? And there's this question. There's jealousy. And generally, pulsatilla patients are warm-blooded and aggravated by heat, and they crave open air and to be in the breeze. So a pulsatilla child who is sick will often want to open the window or drive around with the windows open, even if they're sick. And then, of course, you know, the mom will say, no, we have to close the windows, but they will feel better with the open air. There's a general aggravation from fatty or rich foods. So the physical state of pulsatilla, there are so many menstrual symptoms. I couldn't even list all the symptoms here. I had to edit way down. But essentially, you've got PMS, you've got amenorrhea, that absence of periods, you've got metrorrhagia, which is bleeding between the periods. So as if it were not enough to bleed a lot during your period, you're bleeding in between. You can have your period be short, the cycles are too short. You can have irregular menses. And I'm sorry to use the word menses, it's just medical and homeopathic term for your period. So it can be irregular. The flow can be changeable, just like I mentioned, the changeable pattern of pulsatilla is seen here as well. You can have marked painful periods beginning right at puberty. Dysmenorrhea just means painful period. Endometriosis is a common symptom, and even vertigo worse during period. Headaches, often migraines, worse during the period. You can see that the whole system and the whole self is really aggravated during these hormonal shifts. This is a person who's very sensitive to the hormonal shifts that go on all month long and for 50 years of your life. Common acutes include ear infections, conjunctivitis, also known as pink eye, cystitis, which is urinary tract or bladder infections, hay fever, and asthma. So it's a remedy, we call it a polycrest, which means that it treats so many things. It can be applied to so many situations. So this is just a very small list of the possibilities. It's all about finding the right remedy for you. So that's just one remedy out of 3,000 that is great for women's health. But of course, we want to find what's right for you, because each person is in a unique state made up of the totality of their symptoms, of your symptoms. So every constellation is made of stars, but each constellation is in a unique pattern. And symptoms are the stars of your constellation, and they describe your unique pattern. So in a homeopathic consult, we're looking for everything that contributes to your overall state. Everything, mental, emotional, physical. These are the stars that make up the picture and the pattern that I can match to a remedy. And when I find that totality, I can find the remedy that matches you the best. So I have two cases to show you. Case number one is a 37-year-old woman with menstrual pain plus, which means it's really bad. So her chief complaint, she says, my most pressing complaint is my periods. They're irregular, painful, and very heavy. I have endometriosis with severely painful periods, bleeding between the periods, excessive bleeding, and clotting. Nausea with the pain, which always leads to vomiting. She has searing pain in her eyeball before her period, which dissipates with the onset of the flow. So that would be a concomitant symptom, searing pain in the eyeball. Mental fogginess with her period and a feeling of being completely worn out and completely spent. She gets PMS. For her, it's moodiness and a feeling of heaviness. Sometimes people get bloated or swollen, and for her, it's a feeling of heaviness. Breast pain with much swelling, bloating, and feet swelling. So these are her descriptors of her pain. She says it's searing, hot, awful cramps that radiate all the way down the legs, sometimes in the front, sometimes in the back. In front, it's in my groin and it shoots down my legs and into my feet. In my back, it's pretty low. They radiate up into my back and then down the backs of my legs into the back of my knees. It comes in waves with large, dark, black clots. It is debilitating. The pain is relatively unmanageable. I think that was her being very understated. Like, yeah, it's pretty unmanageable. The pain is so bad I vomit, generally once a month, but sometimes I will have it once every 2 weeks or all month long. So it's a life-changing situation for her. So by way of explaining how bad it was, she said in high school and college, I took Darvocet, which is an opioid pain medication that's no longer in use, but it tells you how bad it was. In terms of her mental emotional state, she's put together, she's energetic, she's a doer. She says, I have a lot of things going on at once. I'm organized. I like to take stuff on. I have a to-do list that's 400 miles long. If I ran for office, I'd be someone's chief of staff. She's private. She has a pattern of keeping her story to herself. And this is part of what she told me about growing up in her childhood, that she kept everything to herself and felt like she didn't want to tell anybody about her childhood troubles. She has a history of grief and a history of too much responsibility as a child, which I see a lot. She has a fear of death and of falling. In terms of the rest of her physical state, she has anemia. She has low blood pressure. She has a history of sinusitis, tonsillitis, and ear infections. And she's got warts, moles, and skin tags. So remember that we're looking for the totality of symptoms so that I can match her the best. So I put in my handy dandy remedy finder, and these are the symptoms that I put in down here on the left. And you can see all the remedies that came across, and we saw some of these when we looked at our lists. The first one is cyclamen, and then pulsatilla. I'm circling, what I did is I circled the ones that I would circle if I'm doing the case that I think, I think that might fit. And then I do further research on that one. Simicifuga, sabina, crocus. And then there are some that I didn't know what that was. XAN, what's that? It actually turns out it's the dandelion. So I would look up remedies that I've never heard of. In the end, I gave her cyclamen, LM1 daily. LM1 means that's the potency of the remedy I gave her. And an LM potency is in water, and it's very gentle, and you give it every day, and then you can step up very slowly and gently. And I often give an LM potency to sensitive patients. So after 1 month of taking the cyclamen, she says she's got an improvement in many areas since starting the remedy. She says her period was lighter, shorter, and less painful. She's got no nausea, brown spotting throughout, but then she's about to start another period. So that was brown spotting, but not bleeding. She felt improvement in the way that she handled family issues that came up. And she said she feels very well in spite of the emotional upheavals of the month. The follow-up after 18 months is that, and of course I saw her in between, but just to conclude how things ended up for her, she's doing very well on the remedy. Her mental fogginess is completely gone. Her energy is really good. She regularly experiences a much lighter period with almost no cramping. So that means she went from debilitating cramps up and down her legs, for which she had to take opioid pain medication, to almost no cramping at all. She has no vomiting, minor clotting, occasional eye pain, and relief from anxiety in many areas of her life, which started with a new feeling about her relationship with her mom. Overall, a huge improvement in all areas of life. So we can see that the remedy affected her chief complaint, her concomitant complaints, as well as her mental, emotional well-being. So here we have another case, a 39-year-old woman with endometriosis, PCOS, and migraines. PCOS is polycystic ovarian syndrome. So her chief complaint here is endometriosis with very painful periods, of course. And she describes that her pain is like her organs are being ripped out or knives stabbing her. It lasts for 10 days of her cycle. Her bleeding is very heavy with clots and stringiness. She has PCOS. She has extremely painful ovarian cysts, and she has bloating and constipation during ovulation. She also has migraines. I could also present this case in my migraine class. She's had migraines since age 13, and she's now 39. The pain of her migraines is neuralgic. So in addition, so that's the nerve pain. In addition, going along with those migraines is tingling and numbness on her occiput, which is the back of her head, extending to her face and down her right arm, and sometimes down her leg. She gets brain fog, which is worse as the tingling turns to numbness, and she gets slight paralysis, which actually makes it hard for her to walk. She has GI symptoms that include bloating, alternating constipation and diarrhea, and of course, she's got gut dysbiosis. Her mental emotional state is that she's a type A personality. She's perfectionistic. She has a history of alcoholic parents. This is a picture that I see often, this perfectionism with a history of alcoholic parents. Her coping mechanism, be perfect. She described school being like a pressure cooker, and in college, she would attend multiple sections of the same class just to make sure that she got the material right. This is the level of perfectionism that she had. She has the feeling of chaos or being out of control is extremely uncomfortable for her. So of course, what she's doing is trying to control the chaos so that it doesn't feel bad to her. She's aggravated by the feeling of being powerless. So here we have my handy dandy remedy finder, and we see a bunch of remedies come up at the top. And of course, it's my job to look at those, not yours. But I can tell you that I looked with more closely at these remedies: pulsatilla, simicifuga, lilium tigrinum, and then way down there, spigelia. That was the remedy that I mentioned that had neuralgic pain with endometriosis and migraines. And that was actually my second choice to give her, because I ended up giving her simicifuga, which also has a lot of neuralgic pain. And actually in this case, she had a particular symptom of her migraines, which was reflected in this remedy, which was a feeling that the top of her head was opening and shutting. And it was such a peculiar and rare symptom that I needed to really give it a lot of weight. So simicifuga is the remedy that I chose, and this is the plant, simicifuga, the black cohosh plant. And I gave her a 30C potency daily in water. And that means that I put a pellet of 30C potency into a little bottle of water, and she took some drops every single day. And this is another way of giving a very gentle daily dose, especially with someone with a lot of pain. And it's a way to give additional remedy if needed, like she could take it twice a day on bad days. I also asked her to take carcinosin 200C once a month, because carcinosin is a wonderful remedy to clear out old patterns. And this old pattern of being perfect and needing to control the chaos and really being uncomfortable with the chaotic feeling is very characteristic of carcinosin. So our follow-up after 1 month was that she had a general feeling of improvement. She had had one migraine with pain, but no other symptoms, and then no other migraines despite her triggers being present. I didn't give you all the details in the case, but eating chocolate and doing various things would trigger these migraines. She feels more resilient with work and her stress. She had dreams that helped resolve old feelings about her parents and made her feel more connected to her parents. And this can often happen. People have dreams that help move along a stagnant or stuck issue mentally, emotionally. And I often see these things resolve as through time as the dreams evolve as well. She had a feeling of being more positive overall, with less anxiety. She does not feel disabled by her mental state. Her period was unremarkable. This is something that's like music to my ears, an unremarkable period, no PMS, and her GI symptoms are persisting. It's only been 1 month though. So after 3 months, she's doing much better. Her periods are much easier. Her endometriosis is much better. No migraines in 2 months, no brain fog. Nothing is triggering me. She stopped all other adjunct support. She'd been doing acupuncture and herbs and stuff. Her PMS is improved. In fact, so much so that her last 2 periods snuck up on her. Often when people say that, I think maybe you know what that means, that, wow, oh, I got my period, but I didn't have any symptoms beforehand to alert me that it was coming. She's mentally even-keeled and optimistic despite stressors. She's letting go of some high expectations. And she feels, guess what? I can't control everything. I can just control me, and that's it. That is a beautiful thing to hear when people realize that you can let go of trying to control the entire world. So this is a great example of how homeopathic treatment supports women's health. In both of these cases, I think we saw all 4 of our points very clearly illustrated. We eliminated or improved the symptoms of the chief complaint. We improved and supported mental emotional health. We improved and supported whole body health beyond the chief complaint. And of course, we are supporting the healing of those glands directly, which is why the pain is improving. And I've included here some pretty pictures of the remedies that we've talked about today with the names. Starting in the upper left, we've got Calicarbonicum, that's also known as potassium carbonate, Sabina, which is a tree, a sepia, which is a beautiful cuttlefish, and we use the cuttlefish ink as a remedy. Calcarea carbonicum is the lining of the oyster shell. We have belladonna, which is a plant. Cyclamen and Lilium tigrinum are both flowers that you're probably familiar with. Natrum muriaticum, such a fancy way of saying sodium chloride, which is salt. Simicifuga, which is that black cohosh, and Ignatia, another wonderful plant remedy. Phosphorus, which is an element, and Pulsatilla, which is the lovely windflower. So to reiterate what Sangeeta has already said, there are things that your mind, body, and spirit need to be healthy. And in addition to getting chronic homeopathic care, I am also interested in making sure that my patients are taking care of these things, which is, first of all, that we're removing the obstacles to cure, which is to say that there could be things that are making you sick. Maybe it's something you're eating or something you're doing or something that you is in your life that needs to change. And we want to remove things that are harming you so that the remedies and the other support that we're giving you can optimally help you. And stress reduction is a major, major issue. This is something that everyone should have a regular daily practice. And it's what I tell every single one of my patients. Everyone should sleep at least 8 hours a night, and really good sleep. And everybody should be optimizing their sleep. I know that sounds crazy, but everybody should be getting deep sleep and REM sleep and not waking up all night. Whole healthy foods, including good fats. Please don't be worried about fat, except don't eat trans fats and vegetable oils and deep fried stuff. Eat really good fats and lots of them. Everybody needs exercise or movement. And if you like it, studies show it's more beneficial. So take the time to find an exercise that you really like and then stick with it. Everybody needs playtime, which is doing something you enjoy, knitting, crocheting, baking, going for hikes, whatever it is. Connecting time with your spouse, children, and friends, and radical downtime. Radical downtime is time when your brain gets to go into default mode network, which is a brain activity that only happens when you do nothing. And it's really important brain time when your brain makes connections, when creativity happens, when it sorts out experiences that you've had. And you can only have it when you're not task oriented, which is why sometimes we get great ideas when we're taking a shower, because we are in the default mode network. And you can be in that mode when you're meditating, when you're doing nothing, or daydreaming. So I'm going to tell you to do nothing for 10 minutes every day and just stare off into space. And it's seriously healthy. So these are some resources for you, and Sangeeta and I can send you these slides so that you don't have to rush through reading them now. But to practice homeopathy at home, here's a resource for remedies, a resource for books that you might want to have. And I have written a practical guide to homeopathy called Homeopathy for Everyone, which is available for download on my website. And this is my contact info if you are interested in talking to me or emailing me or asking me any further questions. But I think that Sangeeta and I are ready to answer some of your questions. So I'm going to exit and stop sharing. There we go.
That was so great. I love homeopathy.
Me too.
It's wonderful stuff. So we had some questions in the chat. And if you all have questions, you can just unmute yourself and speak, or feel free to type it into the chat box. So I think these were here before you started talking, Alexis, but there was one about stopping birth control and then haven't had a period since then. And then a question about breaking down and absorbing foods adequately. How do you know if that's happening or not happening? So for the first question about, you stop birth control pills and then you don't have a period. My first comment is I think homeopathy is a great resource for that because I've had a few cases where that's been an issue that I've treated homeopathically and it's worked really well. There's also some testing you can do to check your hormones. Like I talked about adrenal hormones, you can check your female hormones, simple blood tests to just see, do you not have enough progesterone? Are you not ovulating? Is there anything in there that might, be going wrong that would be easy to address? But it's also pretty common, I think, when women stop birth control pills to not have a period for a certain amount of time.
Yeah.
And then it also depends what your cycles were like before you started birth control. Like some women are just prone to having irregular cycles, skipping cycles, not having periods here and there. And that's why I think if that's the case, especially, I think homeopathy is a really good option because your body's stuck in a pattern. And homeopathy is a really great way to break you out of that pattern and give your body just a little gentle nudge to sort of put it back on track of where it wants to and needs to be. So,
one of the things that Sangeeta and I share a favorite teacher, Will Taylor, who often talks about getting stuck in the chronic, in a chronic pattern of dysfunction as opposed to just like a normal life function. And I think that's exactly what's happening here. You're stuck in this pattern where the body is not, the hormones are not operating as they're supposed to, and they need a little kind of jump start to move back into a normal pattern. And that can be done with homeopathy, treating your whole person, because it's just like in those cases that I showed, it's going to be treating your organs as well as the pattern that you're stuck in.
Yeah. That would always be my go-to, especially if, I think it was Elena that asked that question. I don't know your overall picture, Elena, but if you're a pretty healthy person and this is really kind of your main complaint, that would be where I would start. Start simple and only get complicated if you need to. That's generally my MO. And then the food absorption question. So usually I go on symptoms first. what's actually on in your body, and is there a reason why you think you might not be absorbing things? The first one would be, are there digestive complaints? And that could be anything, low appetite, extreme appetite, gas, bloating, heartburn. I mean, pretty much anything. If there aren't any digestive symptoms, but you just feel depleted, tired all the time, maybe you're not sleeping well, things that I mentioned might be hormonally related or stress related, then there are tests. There are always tests you can do: simple blood tests, salivary tests, urine tests, you name it. There's all kinds of tests out there that would give you a picture of how well you're absorbing things.
What about something as simple as, what if there's undigested food in your stool? Is that is that kind of a very visual example of not absorbing, not digesting your food?
Yeah, absolutely. Like if you commonly see undigested food in your stool, or you have just, bowel movements that some are really loose and runny, some are really hard and constipated, just all over the map and very irregular, that's usually a sign that something's going on in your gut and you're probably not absorbing well. That's a really simple way, for sure. But if you had a more specific question, let's see who asked that question. Natasha. If there was something more specific you wanted to ask, just let us know. We might be able to answer it.
No, that was great. That was great. I was just kind of a general question, because I hear this come up a lot in discussions about gut health and so forth. And I didn't personally have anything, but I just wanted to know, like, what would you look for? But it's so broad that you did name a few of them. So thank you.
Yeah, and there are a lot of, I would say, gut malabsorption, especially over time as we age, it plays a big role in a lot of chronic conditions. Because if you're not absorbing what you're eating, you could eat the cleanest, healthiest, most well-rounded diet on the planet, but if it's not getting to where it needs to go, you're not going to be making the things you need to make, immunoglobulins for your immune system or hormones. So you really have to have a pretty solid gut to have everything else function well. There was nothing else in the chat, but are there any other questions? Oh, question from Elena. So, has lost the feeling of being full or hungry. Could that be a part of that? I'm not sure if you mean a part of the loss of menstrual cycle or just a part of the absorption of nutrients. But yes, so not knowing if you're full or if you're hungry. It's funny, I just had a teenager who had this issue just 2 days ago, had lost that connection basically to her body. She felt like she was in her head a lot, and she wasn't really sure if she wanted to eat. She was eating regularly because she thought she should, but she couldn't really tell if she was full or hungry. And a lot of times that is a mental emotional symptom, I think, that we lose that connection between mind and body. Whereas like an actual lack of appetite, where you're really just never hungry or you're ravenous all the time, is usually a little bit more physiologic. Like there's something in there that's increasing or decreasing your appetite. But there are lots of reasons why that could be happening.
Aren't there, I've just been sitting here to think of the name that starts with a G, and I want to say it's not ghrelin, but it's the hormone that tells you when you're full.
Ghrelin.
Ghrelin. Yep. Hey,
yeah,
I was
you're
close.
Right. You're right. I don't actually know if that's how you said Grelin. Yeah. That and leptin play a big part.
Yeah. And could there be an imbalance of those things that could arise for some reason that could cause that issue?
Yeah, definitely. That it's kind of broad spectrum symptoms like that they could be attached to a lot of different things, because appetite is controlled by so many different factors. It's hard to know exactly what it would be, but yeah, that's definitely a possibility. And that is in sort of the hormone category, what Alexis mentioned. Ghrelin, however you say it, and leptin are two molecules in the body that have a lot to do with feeling full. And they've been linked to obesity a lot, where people just keep eating because they don't have that trigger that tells them they're full. But I'm sure it could probably go the other way too. Any other questions? Anyone? Susan, you have any questions? Nope.
Nope. Okay.
All right.
Well, I think what we can do is we're going to send you the slides from this presentation so that you can look them over, and you have our contact info if you have any other questions. And
we'll post the video. So once the recording will stop, I will process it. And then tomorrow or the next day, in the next couple days, Alexis will post it on her YouTube video, and we'll send out a link, and you'll have a link to it in case you want to review anything.
And send it to any friends that you have who have daughters with these issues, or other friends.
Yeah, absolutely.
Thank you both so much. That was so great. It was really informative.
Good. I'm glad you enjoyed it.
Thank you guys for being here.
Yep. And we're going to do this again probably next month-ish on menopause and perimenopause. So
that's right.
Join us again.
All right, good.
All right, everyone.
Good night.
Bye.
Bye-bye.